I want to welcome all of our viewers. My name is Ian Hensel. I am one of the publishers at Rattling Good Yarns Press. You can see it above my head. And I'm here with Rick Karlin, the author of one of our newest titles, a memoir called Paper Cuts: My Life in Chicago's Volatile LGBTQ Press. And I thought it would be very interesting if we touch base with Rick. He has had a very extensive career in the LGBTQ press since the late 70s, and he's very much been a watcher at the gates, seeing the changes in LGBTQ culture. And now we're going through the COVID-19 coronavirus pandemic. But back starting in the very late 70s and early 80s, we as a community, as an LGBTQ community, had the AIDS crisis, the HIV epidemic. And I thought it might be interesting to get Rick's elder statesman view and his perspective on how this pandemic may change us. Okay, Rick.
Well, I think I have, especially now that I am older, I have a long-term view that I can see things along the path a little more clearly. I can see patterns. I can see how history repeats itself. We're repeating the pandemic with the pandemic now, a lot of what went on during the AIDS crisis. So we're seeing a lot of repetition of that and how we can survive and get through it. Although this pandemic is very different than the AIDS crisis pandemic.
Well, in your role in the LGBTQ press, you bore witness to a lot of cultural changes, including, as you said, the rise of AIDS in the LGBTQ community. How did you see that health crisis shape and mold the LGBTQ community?
Well, I think it brought us together. Nothing brings you together more than having a common enemy. And all factions of the gay community were hit by this. The intellectual, literati, the leather community, the leather intellectual literati community. Lesbians were incredibly supportive at that time. They really stepped up and helped out when gay men were busy fighting for their lives. The lesbians were out there helping us a lot. And before that, you had begun to see a real division of lesbians and gay men. Early in the fight, everybody was considered gay. Then it was gay and lesbian. And then it was the lesbian separatist community. And the AIDS crisis brought people together. We had a common enemy. We had a common enemy in the government who was ignoring the crisis and discounting the lives of gay people. And we really worked together to provide services and support when the government wasn't doing it.
Well, given that you saw how a virus could change a community and the community's culture, keeping that in mind, what's your thoughts on the current COVID-19 virus? And are there similarities you're seeing between COVID-19 pandemic and HIV in the LGBTQ community? How do you think
There
the
are
pandemic will
some.
impact us?
More the similarities are more in the ineptitude of the federal government. I think with the AIDS crisis, because it was primarily hitting minority communities, the government being Reagan, was they were willing to dismiss it and let the community rock. They didn't care. They felt it was that they had it coming to them, kind of thing. Now, I think it's more ineptitude of government, not benign neglect, but actually just neglect, that Trump and his people, he's hired incompetent people, so of course the whatever they're coming up with is not working. The other thing is we can't go out and riot and fight for our rights because that would just spread the virus. So that's a major difference. And the community cannot come together physically to fight. And when you can't come together physically, it's hard to come together intellectually as well.
But kind of going back to something you said about how the LGBTQ community changed, that a lot of schisms were healed. Do you think, if we look for the positive in the COVID-19 pandemic, do you think that there are some bridges being built and people are coming together in different ways than before?
I think there may be. I think a lot of what's there are people doing wonderful things. I know people who are sewing masks and donating them to hospitals, and you know that's all wonderful, but it's a lot like a lot of the recycling stuff we do. It really doesn't amount to a hill of beans, because the amount you need is the amount that only the federal government can provide. And you need mass quantities that you're not going to get from, somebody sewing 20 masks in their kitchen every day is not going to make much of a difference. But I think what is happening is that hopefully people are coming to realize how inept Trump is as an administrator and so-called leader, and that they will be able to look beyond the politics, just as his ability as an administrator, and toss him out in November, and hopefully get an administration in there who is ready to work with get the various parts of government working again and help to solve this, because that's the only way we're going to solve it.
Yeah, and I think it'll be interesting, just like with the with AIDS, because definitely the LGBTQ community, I mean, obviously many years have passed, but some fundamentals in the community are very different from the way they were prior to the epidemic. So it will be interesting how our society changes after this epidemic. And it might be very interesting to see what changes and what we've learned about social distancing and how long this goes on for, that we have to maintain some social distance, even, when we start to get back to whatever normal looks like, how that may impact LGBTQ gatherings and social events. I think it will be very interesting.
I think it's also been I bet you this pandemic has been a lot harder on the LGBTQ community than the widespread community, because we basically have our families of choice that we've built, but we don't necessarily live with them. So if you live with your family, you have a support system there, whereas I'm sure more LGBT people live on their own, or just a couple, and they don't have the rest of the support system, so they're relying more on each other long distance rather than up close.
Yeah, interesting you should say that, because I know several people that are feeling very isolated because the bars are closed, at least out here where we are, the LGBT center is closed. So a
Right.
lot of the support mechanisms and social outlets don't exist. And I know that there are a lot of people struggling. It'll be interesting to see how our LGBTQ community changes as a result of this pandemic.
Yeah, and I live in the gayest city in the world, in Wilton Manors, and um, you know, it's the numbers of people infected with with the COVID-19 are now more than 10% of the population.
Oh, wow.
So of the city. So and it's a lot of people that are, you know, living by themselves. And it's also a lot of elderly people. So that's going to be a very dangerous situation.
Yeah, we'll see much more in the days and weeks to come. So a big thank you to Rick Karlin for joining us to share his views about the current COVID-19 pandemic and how it may relate to what the LGBTQ community experienced in the late 70s, 80s, 90s, and into the early part of this century. His memoir, Paper Cuts: My Life in Chicago's Volatile LGBTQ Press, is a fascinating read. I encourage you to get a copy and read it today. It's not only informative, it's a very enjoyable read. You can obtain a copy by going to our website. That's rattlinggoodyarnspress.com. Again, that's rattlinggoodyarnspress.com. And we are also, from time to time, we run specials and promotions. So please go to our Facebook page. If you go to Facebook, search for Rattling Good Yarns Press, and you'll see any available coupon and promo codes that might be available. As always, within the US, we offer free shipping. You can also obtain a copy through Amazon.com, as well as a Kindle edition, or from fine booksellers everywhere. So again, this is Ian Hensel, publisher at Rattling Good Yarns Press. I want to thank you for joining me today. Have a great day and be safe and be well. Thank you.